So the government is today launching its first ever men's health strategy, which slightly blows my mind that it is the first ever. It covers both physical and mental health, because 1 in 3 men in the UK have either a physical or a mental health condition.
That number is too high, and we've got 2 great people here to talk about it with us. Stephen Manderson, known, of course, as Professor Green to many, and Amy O'Connor, who's the policy lead at Movember and here in studio. A very good morning to you both. Thank you so much for joining us. And Amy, we just chat. I mean, we could have used a number of statistics to highlight why all of this is so important, but actually the one that I would have picked is that suicide is the biggest killer of men under 35 in this country, and it's one of the biggest killers of men under 50, and 3/4 of all suicide are men. I mean, these statistics are terrifying.
Yeah, they never continue to not be shocking. Simply put, too many men are dying too young through suicide, but also conditions that are preventable, looking at cardiovascular disease, men not engaging in healthcare services not working for men, and we're seeing this rate of premature mortality that we need to turn the tide on. And that's why we're welcoming today this historic men's health strategy that people across men's health have been calling for many, many years.
You're a big campaigner on some of this stuff, aren't you? On mental health, on men speaking about things more openly, on helping, you know, other guys. Just talk me through a bit about why that is.
My father took his own life, which was obviously quite a seismic event in my life. I was 24, and you know, I turned the age he was when he took his own life next week, 42, which is way too young. And I think a lot of it stems from, for all the work I've done in and around it, all the conversations I've had, you know, it stems from men largely not being able to communicate how they feel and not being able to sit with the feelings that they have. And there's quite a steep arc into secondary emotions, you know, hurt, anger, sadness, anger. It becomes almost a defence mechanism, and it doesn't allow for us to really deal with anything that's happening internally. And I think there's a real detachment from self, and I think men probably realise that at this age. You know, we call it a midlife crisis. It can be passage if we deal with it well and ascend into a more authentic adulthood. But men suffer, and they don't engage in services until the point of crisis. And we need to fix that. We need to create early access points to aid early prevention, and we need to do that in a way that men can listen to, hear, understand, and want to engage with. Because if we don't talk to men how they best hear things, we're not going to engage them in these services.
It's amazing the statistics on suicide are so tilted, specifically to men over women. Do you think men are more lonely than women? I mean, where does that come from, do you think?
I think it comes from the detachment. You know, there's a difference between, you know, you look at solitude and isolation. They're seemingly the same thing, but they're not. They're very different. Solitude is when you are at peace with self, and that might sound hippy-dippy and airy-fairy, but isolation is when you are removed from everything that creates healthy environment, community. You know, these things are lacking, and we're becoming ever more detached and disconnected.
Can I ask, if you're happy to answer, in the wake of your dad's death, did you feel like you had people you could talk to then?
I didn't know what to say. You know, I was really lucky in that I had an outlet in music, but it hasn't meant that I've been absolved of all my issues. And I think all too often the problem is, as far as our society, there's systemic failure, because these issues are born so early on. You know, young boys are being failed, you know, especially boys from disadvantaged backgrounds. They are overrepresented in every single negative statistic that needs looking at. So, you know, the men's health strategy is incredible to get over the line, and the fact that Wes Streeting has said that he's going to do something and has got it done is incredible. It needs to be cross-departmental. This needs to be about boys as much as it does men.
Amy, tell us more about Movember, because some people... when did it start? It's been going so successfully for so long, but it has evolved as well to really cover these areas that we're talking about, having started in a more focused area.
Yeah, so Movember came about in Australia in 2003. originally in prostate cancer, but now working prostate cancer, testicular cancer, men's mental health, but also doing a lot more work in the advocacy world and looking at how do we reach men with healthcare messages, how do we advocate for policy solutions, so government are investing in men's health, and how do we make services work for men. It takes a lot for a guy to overcome all of the gender norms, to ask for help and go to the doctor, and when they get there, we're failing them too often. So when we're looking through the men's health strategy and we see investment in community programmes, there are fantastic community programmes up and down the country, men's sheds, outreach programmes, talk clubs. Investment in those type of programmes is what we're advocating for, as well as training for clinicians, training for doctors so they can better communicate with men, like Stephen says, in the language that they use, and interventions through sport. So the men's health strategy announced a fantastic partnership with the Premier League. We've talked about Movember. We were founded in a bar. We do work in sports clubs. There are men growing moustaches up and down the country now.
This is your chance to pitch for him to get the moustache.
I think he would look fantastic with a moustache. I think most men do.
If Stephen had also, shaved the bottom part, then maybe I could have matched up.
Well, I did trim it, but it's caught back up. So
It doesn't look that trimmed, I'll be honest.
I don't actually have to shave. I just drive at 60 and stick my head out the window. I still can't grow a
Is
beard.
the official thing of November you're meant to start on the 1st of November? Or can you, because it's a bit embarrassing otherwise, it's just going to be a bit half-hearted.
You can shave down on the last day of October, the first day of November, and grow that tash out all month.
There you go.
Keep clean shaven elsewhere. My husband's got a lovely little ginger mo coming through that the whole family are appreciating. But there's other things people are doing as well. I'm doing a cold water swim challenge. People are running marathons. And it is because people have this walking, talking billboard of a moustache, or they're doing these incredible challenges, that has meant people like West Streeting can see that people care about men's health and they want change. So it is a big thanks to...
Thank you both for joining us. We're out of time, I'm afraid. Amy, Stephen, it's been a pleasure.
Cheers.
We really appreciate it.